everyone. This is Michelle Gramoglia, the president and CEO here at Woodland Pond, and this is my first weekly address of 2025. Today is Tuesday, January 7th, 2025. I hope that you are all well. So as we go into the new year, we're kicking it off with quite the cold spell, and I just wanted to chat about a couple of things related to the cold and the snow. First and foremost, the friendly reminder that we are living in the Northeast, and there are a whole variety of different types of winter weather that we can encounter. Some are actually easier to manage, the more significant that they are from a snow removal perspective than some of these little piddly kinds of things that happen, more of like a snow squall type nature or a dusting. And I just wanted to address that for a few minutes. When we have a snow event of any kind of accumulation, our snow contractor does become involved. And depending on what is forecast and what's actually happening is how the snow contractor and our operations team coordinate to ensure the most appropriate snow removal. It's very easy when we have a forecast of 6 to 8 inches or something like that, and we can anticipate this is going to be an actual storm, and we kind of have a prolonged or an estimated duration, and then we know, once the storm stops, we're going to have to do wide scale clearing off of cars, in between cars, clearing the sidewalks, that kind of thing. All throughout, of course, we're clearing the sidewalks and making sure that they're passable, and that is very important. When there is an unanticipated snow event, the snow contractor certainly still gets involved to the extent that there's accumulation, but our staff also is here to assist in snow removal. And when we have something that's like a dusting or something that occurs that is not a material accumulation, there is not an appropriate purpose for the snow contractors to come and shovel out, for example, between cars for a dusting of snow. Or to brush the cars off in that case. They're really there for snow removal. It's very important that all of you as residents and staff members are equipped with the typical, very basic, brush for your car and those kinds of things for a dusting. In the event that you need assistance with that, please do let us know, and we're happy to help. The most important thing, regardless of the type of event, is that, first of all, you're paying attention to the weather, either by looking at weather apps or looking out the window, anticipating your schedule, meaning that if there's any kind of an event, whether it be rain, snow, ice, a huge storm, and knowing that you're going to need your vehicle, and for some reason it might not be available unless you have assistance, letting us know that with at least an hour or two notice. We want to help you, certainly, and we understand that some are more capable of being able to do these tasks independently than others, but we can't have a last-minute emergency. I have a doctor's appointment in 15 minutes in Poughkeepsie. We can't always accommodate that. So being aware of the circumstances, being aware of your schedule, and engaging us early enough to be able to assist you is really critical. And the other thing is, as a reminder, and this is not just related to snow removal and ice and so forth, but we need everyone's eyes and ears on campus all the time to let us know something might be wrong, whether it be a slick spot outside, or maybe you see a hanging ceiling tile, or a branch that's crossed the road. You may be the first person that sees that. And it's important that we all look out for each other, that we all look to protect each other, and that as soon as you see an issue of concern, that you contact either concierge or reception and ask them to place a work order. And it's always better for us to have 2 or 3 or 4 work orders than to have none. And no one should ever assume that there's a Woodland Pond staff member that may have just seen the same thing, or another resident that reported it. So please do be our eyes and ears, and please help us keep the campus safe and secure for all of you and your neighbors. The next thing I wanted to touch on was something that we included in the Chanticleer on this past Friday. And this primarily relates to independent living, but I also just want to expound a little bit on a second section that was included in the Chanticleer as well. So first, I want to just make sure that everyone in independent living is now aware that as of yesterday, we are no longer providing COVID tests in independent living. You certainly can purchase them at the pharmacy if you'd like to have them, and we can assist you if you're not sure how to perform that test. You shouldn't stop calling if you have a question. But what we have found, and we have tried sort of as much as we can to say we have to, sort of stop thinking about illness in the context of COVID and COVID and COVID. Illness as a whole is more broad than COVID, and COVID tests in particular have nuance. And so we've really seen those COVID tests become quite a crutch for medical care, and they're sort of preempting sound infectious disease control and sound medical management. So certainly if you feel like you want to have COVID tests, please take them. But the important thing to remember is that the COVID test and a COVID diagnosis is not the be all end all, whether it's a yes or a no about whether you may be ill or contagious. And more than anything, we really want residents to start thinking about illness itself and symptom management the way we did before there was such a thing as a COVID test. Listening to our bodies, talking to our healthcare providers, managing symptoms, monitoring symptoms, reporting symptoms to our wellness RN. Again, this is really strictly for independent living because the higher levels of care have nursing staff interacting with you every day. But if we put all of our faith in a COVID test, or we assume that because we might have been around someone with COVID, or we might not be feeling well, we take a COVID test, that doesn't tell the full picture. You can have a positive COVID test and not be symptomatic or contagious at all, because we know that those tests can show a positive 90 days after you've been sick. And you may not have even felt that sick. Many of you are vaccinated. Most of you are vaccinated. So there's a very good possibility that you may have had COVID within the last 3 months, didn't know it, and then for another reason take a COVID test, and then all of a sudden, you're concerned that you have an active illness and you're contagious and so forth, and that may not tell the whole story. On the other hand, you may be feeling really lousy, and you may have been exposed to someone with COVID within the last week or two, but you take a COVID test and it comes up negative. So that would suggest that that test did not test positive for COVID, and maybe you don't have COVID. But if you're feeling lousy, it is flu season. RSV is prevalent, and pneumonia right now, viral pneumonia, is all over the place. It's affecting young people in a way that it hasn't in the past. And so it's really important not to place, for both positive and negative, such a great emphasis on the COVID test, and to really be thinking about staying in when you're not feeling well, being aware of who you're around that might have been sick, and knowing your body and contacting your physician. That is the most important thing. Please, let's really try to focus on that and not so much on what this one test may or may not say about this one particular illness. We are always contending with viruses, and it needs to be more of a comprehensive healthcare approach. Again, COVID tests, of course, are available in the pharmacies, and many vaccines are available for COVID, flu, pneumonia, for all of you that are interested in that. One other thing I wanted to just emphasize that was in the Chanticleer from last week, and this does come up periodically, is that in each level of care, Woodland Pond is licensed differently to provide a level of clinical support, medical support. In skilled nursing, you have a medical director, which is a doctor, a nurse practitioner that works on days that the medical doctor is not there. You have medical staff, doctors and nurse practitioners on call 24/7 that are our contracted people, so they're not doing that through their own practice. They have to be on call for skilled by regulation, and we pay them to do that for us, for our skilled nursing residents. You have registered nurses there on duty 24/7 on the floor. You have administrative registered nurses supporting the operations. You've got multiple licensed practical nurses on the floor at any given time doing treatments and med passes and filling out physician's orders. You've got certified nursing assistants. You've got the whole gamut. You don't have emergency care because we are not licensed to be an emergency room, whether it be in skilled or from skilled out to the rest of the community, but you do have access to medical care on a non-emergent basis around the clock. And that is the license to do that under skilled nursing. In assisted living, you have something similar in that you have licensed practical nurses 24/7, you have certified nursing assistants, and each resident has a relationship with their primary care physician. And none of those physicians, with the exception of one, which is Dr. Patel, whom we contract with to do this service, is on site at any time. Well, Dr. DiNapoli does also have patients in assisted living and Garden View, but the bulk of you have doctors that are out in the community if you reside in assisted living or in Garden View memory care. So if there's an issue that arises, it necessitates that our staff contact your physician in the community and await them to call back, whether a new order or maybe their on-call service. So there's somewhat of a delay, but that is a process that our staff handles and helps you to facilitate based on our observations, your reports of not feeling well, let's say, or pain. We're the go-between on that for you. We facilitate that communication. And again, in the case of Dr. Patel and Dr. DiNapoli, they can see you on site a couple of days a week. And in each of those cases, skilled nursing and assisted living, we have staff that are hired specifically for those licensed units. They're licensed separately under New York State Department of Health regulation, and those staff are assigned to those units and must remain on those units. In independent living, we are licensed as a CCRC, which is not a clinical setting. We do have an RN, that's a wellness RN, that's Mary Jo currently. And she's here 5 days a week, except when she's on vacation or has a day off. And she's here to help you with very basic first aid, maybe check your blood pressure, help you find a physician. This is not really medical care in the way that you would think of it if it was being provided by a licensed practical nurse or a doctor. Mary Jo can't fulfill your physician's orders, for example, like a nurse in assisted living or skilled nursing can. She's here to support you from a quasi-medical perspective, but she's not licensed to be a full-on nurse and provide nursing care. And she's not here 24 hours, 7 days a week, because this is independent living. It's really important that residents understand that there is a distinction between what staff can and cannot do, and that in no circumstances at Woodland Pond do we have emergency services licensure. If there is an emergency that cannot be attended to by the assigned staff on those particular units within their scope of practice under the regulations, we have no choice but to call emergency services. That will prompt us to call EMS, and they will provide they will render service to you and make a recommendation about whether or not you should seek further care at a local hospital. For any resident in assisted living, memory care, or independent living, you are certainly welcome and encouraged to seek your own medical care with the help of your family or friends in the event that you feel that emergency medicine is not needed, but you're not feeling well maybe, or you think maybe you hurt your wrist. Certainly all of the normal options like urgent care, the emergency room, and making an appointment with your primary care physician in their office is a great option and really what you should be thinking about doing. If you have any questions about any of this, you can ask really anyone in our leadership team, and we can help you clarify. But we just want to make sure that that expectation is set and well understood, because it does cause some confusion. And over the holidays, especially with people on vacation, there was a little bit of frustration expressed by some residents and some family members that, particularly in independent living, maybe the wellness RN wasn't here 7 days a week because she's not. or that there's limitations to the services that we can provide in any level of care, and that all is attributable to our licensure. A couple of things out of the business office. A number of you have worked with Christy Battistoni, our Director of Finance, over the last couple of months during Medicare open enrollment to change your insurances, whether it be from a traditional Medicare to an HMO, or from an HMO to traditional Medicare, whatever it is. Anyone that has a new insurance card or new insurance policy effective January 1st, we absolutely have to get a copy of those insurance cards so that we can get them on file for you and get them into your emergency packets. So please make sure to do that. And if there is anyone that renewed either your vehicle insurance or your tenant's insurance, which you're required to carry both of those, as well as personal liability under your contract with us, any updates to those policies, they should be brought to the business office. As of yesterday, the Woodland Pond annual actuarial tax letter is now available at concierge for you. If you are seeing me and you are a resident or a loved one of a resident, it is very important that you pick this letter up. They're available again at concierge, and this letter should go right to your tax preparer. There is a good possibility that some portion of the fees that you pay to Woodland Pond may bring you a tax benefit against your tax liabilities, and that letter will outline for your tax preparer how they should navigate that. If you need us to email, fax, or scan that letter to your tax preparer, please do let us know that along with their contact information, and we are happy to do that. As we approach now, we're in the first quarter, of course, and while we had a little bit of a strange hiatus with the holidays being the way that they were scheduled, or fell, I suppose. They weren't scheduled, but the way that they fell, some of our sort of typical capital projects were placed on hold, but will be resuming in some great deal of earnest in the next few weeks. And I will be asking Dave Roberts to include major capital projects that don't have anything to do with the renovation or expansion, but are going to potentially be something that the residents may feel the effects of. So it's really important that you make note of the following things that will be ramping up in earnest over the next 3 weeks, if not sooner. First and foremost, we had scheduled to have engineered, which is completed, and replaced the industrial-sized walk-in coolers and freezers in the main kitchen as part of us having turned 15. And these are things that were there even from before we were open, because they were one of the first things installed before we could get residents in. And we knew that they had approached their useful life. We had, again, hired the engineer to do all of the design work in late 2024. It took quite a good amount of time for those units to be fabricated and created off-site, and we are now ready to begin the installation of those massive walk-ins. And for those that have not done the kitchen tour yet, I'll use this as a cheap plug to make sure that you do a kitchen tour at some point when you see them on the calendar. But in order to facilitate these walk-in replacements, which are built into the building, it entails a few things. And in order to ensure no disruption of service to the residents, we have contracted with a company to hire a mobile cooler/freezer system that is on a tractor trailer. It will be run by a generator, which is unavoidable. We understand that that's not the ideal, but there is no other way to handle this. We have to be able to ensure that the food that we are using for service is meeting all the Department of Health regulations, and these mobile units ensure that, but they do run off generators. So beginning over this weekend, actually, you will see a very large 18-wheeler tractor trailer will be placed in the front parking lot. Again, unavoidable location because it has to be proximate to the kitchen to be able to get all the supplies where our staff needs it when they need it. But for the period of time that the coolers are being demolitioned and then replaced, in the main kitchen, which will be roughly 4 weeks, there will be a sizable tractor trailer out in front of the community, and it will run off of a generator. Now, what we have instructed everyone involved is that we will not be turning that truck on until just before we need it so that it can get up to temp. So it may sit here for a few days without being turned on. And that's it really because it's a nod to the fact that this is, running off a generator, which is not, an ideal situation from, a sound perspective and a sustainability perspective. But again, we have no choice. We have to have the product on campus. It has to stay cold. And it's a massive amount of product if you think about how many meals we are creating a day. So during the period of time that the work is being done, all of the cold product will be maintained in that trailer, and you will see our staff coming through the side door next to the library. You will see a little bit of a different flow of that traffic. I'm not sure if they're going to be taking the items straight downstairs and then come back up through the kitchen. I will make sure that Dave addresses that on Friday in his weekly address. That to me seems like it would be convenient, but we will work through that with you. But yes, you will see that there, and that is what's happening with that. The replacement of the coolers has no impact on our production in the kitchen, meaning all cooking and preparation will still happen in the kitchen. It's just the storage of the cold items will happen in this very large tractor trailer, which will be in the front of the building. The next thing that you will anticipate hearing about is that after much delay, because the lead time on this particular unit was extensive and got extended multiple times, the HVAC unit that feeds the pool, which glitches and has sort of been determined to have been missized right from the start, we did have that re-engineered. Again, the engineering work was done in 2024. We ordered the appropriate unit to replace the rooftop unit that we have there. Very sizable project. Each of the projects I'm talking about here are somewhere between the $200,000 and $350,000 range each. So these are very sizable projects, but we budget for these kinds of things because we know that we have to keep the community going and comfortable. But that pool pack is what it's called, will be arriving soon, within the next couple of weeks. And my anticipation is it will require a crane to take the old one off and put the new one in. And there will be some engineering time. So the pool will be taken offline. It will be unavoidable. You won't want to be in that room, especially with it being as cold as it is. We will have temporary heat to ensure that we don't have any pipe issues, but we will be closing the pool room and the pool for as short a period of time as we possibly can. But in the long term, this will be for the best. And some of the seasonal issues and challenges that we've had with that unit over the last decade will be alleviated. So again, stay tuned for that information. That will be coming in the next few weeks. And then the last thing I wanted to mention in this vein, and this one fortunately is not a $200,000 to $350,000 project, but this is a routine safety investment that we make annually, not required by regulation, but very good practice, is we do have a firm that comes in and does duct cleaning for us. Again, this is duct cleaning. And, even though we have a generally clean environment and we don't have a system that sits dormant for much time, dust and other debris can accumulate in the heating and cooling ducts. And so we had decided years ago that annually we would have some portion of the community have its ducts be cleaned so that routinely all of the ducts are generally getting cleaned. So the 2025 duct cleaning for independent living will begin in the South Wing. This is strictly for the corridors, and the reason it's the corridors is because during your annual preventative maintenance, our staff does the cleaning out of the HVAC in your individual units. But this is for the wings and the corridors, and we will start in the South Wing. And again, there really shouldn't be much of an interruption to you, but you may see staff with, well, not staff, but a contractor blowing out, and it could be very loud, it may be dusty. We've been through it before. It's usually actually relatively clean and relatively quiet, but it's very important that we are making sure to communicate that with you so that you know what's going on. And again, once we have that specific start date, we will let you know. We have a lot going on with routine on campus goings on and things that are really starting to ramp up with the design for the on-campus renovation. I can't emphasize enough the need for everyone to please, please, please consume Dave Roberts' weekly addresses on Fridays. It's going to be the best place for you to keep current on the projects and to come to our management Q&A each month. There's an article in Woodland Life this month that Dave goes into detail onto what to expect. We're really trying to get the information out there, both capital projects and renovation. This evening, there is a Village of Newport's Planning Board meeting. This is the next one that we are invited to. And then tomorrow, our project is actually going to the Ulster County Planning Board. So I think those are the dates. But at any rate, Dave will give you all an update on Friday, but things are definitely cooking. And if you need anything, you know where to find us. Have a great day.